Dr. Lee here. Today I have a post-op follow-up with a patient that had a vaginal rejuvenation surgery a few months ago, and we were just visiting, talking about some of the common things that patients ask. One thing that she brought up is after a procedure like this, what's really important, and she explained it, is that it's really important for the partner to make sure that they are patient and gentle. And that would just be like if a woman had a vaginal delivery and after the delivery, they resumed relations generally 6 weeks after. Same thing in this procedure. So is there something that briefly, you had told me that it was a little bit painful at first. Is that right?
Yes, it's because we was very nervous,
Yeah.
and he doesn't want to be like so rude, or
Right.
he doesn't want to stress me so
Right.
much. So he was nervous. I was nervous.
Yeah.
And I was dry.
Yes.
And but when he first put it inside,
Yeah.
oh my God, feels like
Sandpaper?
huge.
Oh,
No,
huge. Okay.
yeah, he feels like he has a huge
Yeah. Penis.
penis,
Yes.
and I was like, oh my God, this is like so weird, right?
Yeah.
And he was like he was not knowing what's going on because it was new for him.
New for him
Yeah.
and new for you.
Yeah.
And so she brought up something, one of the reasons why patients have this type of procedure is oftentimes if the vaginal opening just gets too wide, childbirth and so on, the vagina gets too wide, they just don't feel the intimacy, they don't feel relations well, and it takes a long time sometimes for them to feel the sensation, to to have orgasms, and that was similar to what she was feeling. And so she said now things have totally changed since the procedure, and so that when her and her husband are intimate and they do have intercourse, it's a lot quicker. And so you're explaining that to me, that it just feels a lot better, right, for you and for your husband?
Yes, actually, he's very happy because I don't know if this is good or bad, but he told me like feels like a different vagina.
Yeah.
Like
Yeah.
he's like, oh my God, I feel like I'm with another woman.
Yeah, right. Well, it's what happens over time is things stretch out, right? And so when you do a vaginal rejuvenation surgery, and I've explained that to you guys before, and we can post things online more about it, but what it does is it helps bring back the normal. And so this young lady, probably what the vaginal canal was like maybe 5 or 10 years ago, it brings it back to that point. And so we help both the patient and the partner. And so what was good to hear is that it wasn't just, her feeling the difference, but also her husband definitely sees the difference. And then there's also just the cosmetic. And we just don't do it for cosmetic, because when she came to me, she goes, I don't really care how it looks. I more want like things to work better. That was her main thing. But from a cosmetic standpoint and how it looks, you're pretty happy with that too?
Yes, actually, yes, because sometimes we get a little bit with low autoesteem because you see all these pretty girls in certain kind of movies,
Yeah.
and they have like so pretty and everything like so tight and everything, and you're like, oh,
Yeah.
and then when you reconstruct,
Yeah.
and you see in the mirror like, oh, it's so pretty.
Yeah, right. And so she's noticed that difference too. So we do this procedure for multiple reasons. The primary one isn't so much the cosmetic look, because it's definitely a benefit for sure. And for her, it's a huge benefit. There's a huge difference between what it looked like before and what it looks like now. But the main thing is that it's a life-changing thing. This allows for her and her husband, for the intimacy and for marriage and for sex to be that much more enjoyable for them, where it wasn't really in the past, because she felt like she just couldn't feel anything. He felt like he couldn't feel anything. And now we're excited to say that everything feels great.
Yes, yes. And I'm going to add something a little bit, like I be done my boobs and my lipo and my tummy tuck and everything people can see, right? And it's good. But this surgery is something total different.
Yes.
Like if I hope I can know about this, like I don't know, 7 years ago.
Yeah.
And I'm almost 40.
Okay.
And I with this surgery, I think I'm going to have like a really good sex life until I get in my 60s or 70s or 80s.
Exactly. Yeah.
So my husband is going to be very happy.
Right. And that's another thing she brings up too, is you want to do this after you're done having kids, because once you're done having kids, it's the time to do it. If you know you're going to get pregnant next year, it's not the time to do it, because it's very likely that when you have that baby, and if it comes through the vagina, it could start spreading everything out again. But she's now at the young age of 40 years old, and she's looking towards the future. And the other thing that I think she brought up a good point is that women often come and they want, their breast aug done, they want their lipo done, they want all these other things done because that's what other people see. But I would say that the vagina for a woman, whether she's married or whether she's in a relationship or she's not in a relationship, is really important, because not only can we help you with the way it looks and feels, but there's also, in women that are a little bit older than her, it starts becoming very thin down, and so we can do lasers, and she doesn't need that. She's young now. But women down that we see oftentimes will not get other procedures done because they don't see like the big difference in the appearance. But if a woman's vagina is nice and healthy, they're going to have less urinary tract infections, they're going to have less yeast infections, they're going to feel less itching, less pain. There's so many just improvements with their vaginal health. And so she brings up a good point. She's had these other procedures done before, but she felt like this time she wanted to think about having something done that was not going to be seen by others, but that she would notice a huge difference in her, and that her husband would too, and they do. So we really appreciate her coming in and kind of just going over these things with us, and we are actually getting calls and seeing people a lot right now for vaginal rejuvenation surgery, and we love to do it, and hopefully people will give us a call. So thank you.